Good morning, friends of the law offices of Brent Williams-Ruth. I am Brent Williams-Ruth, and it is the start of Thanksgiving week 2025. And I just wanted to come and make this video after speaking to the East King County Estate Planning Council last week. The discussion focused around the Washington estate tax, capital gains tax, and the tax cuts in the One Big Beautiful Bill. Now, the moderator asked the panel, what provisions of the bill did we as panelists want to make sure everyone knew about? And I think I may have surprised some folks when I didn't talk specifically about any one tax that was individual, but pointed out that the One Big Beautiful Bill, depending on how you print it, is either 900 to 1,200 pages of legislation. And that within that legislation, there are thousands of changes in the law. This past week, we just saw one of those provisions get implemented through the Department of Education, which was the reclassification of nurses, ARNPs, physician's assistants, physical therapists, and so many more as not professionals. I don't know why this came to be. I don't know why it's catching people off guard, except for the fact that the One Big Beautiful Bill had so much big ticket items, billions and billions in cuts for Medicaid and Medicare and tax cuts for the uber wealthy, that all of the oxygen was sucked out of the room for the countless thousands of other provisions. So I'm going to take it upon myself to share some of the things that I've learned that are keeping me up at night and making me worry about the future. And the first is the reclassification of inpatient-only medical procedures for those on Medicare. Now, again, this is not Medicaid. This is not low income. This is every United States senior that is over the age of 62 or 65, depending on when you chose to sign up. The entitlement that you have earned. That program is going through a 3-year phased reclassification. That's the term they're using of inpatient procedures. So on January 1, 2026, so approximately 50 days from today, 285 mostly musculoskeletal procedures that had been an inpatient procedure are now going to be reclassified as outpatient. What does this mean? Let me just make up an example. Grandpa needs to have a hip replacement or a knee replacement. Now, to be absolutely fair and transparent, I have not looked at the list of 285 procedures. So I don't know if hip or knee are going to be in this first wave, but what was given to me was 285, mostly musculoskeletal. So grandpa needs a new hip. Right now, if he were to go into the hospital right now in November 2025, the doctor would do the hip replacement and then they would stay in the hospital for the initial recovery. And then if they're still needing some assistance, after 3 days, they would qualify to then go to a rehabilitation facility covered by Medicare. And then there's a 20-day initial authorization. And after 20 days, if you're still needing more time, the doctors can fill out the paperwork explaining why you're making progress, but you're still not ready to go home. You can then get up to another 110 days of rehabilitation stay on the dime of Medicare. So, what happens when grandpa needs a hip or grandma needs a knee on January 2nd, 2026? They will go in, their surgeons will do an amazing job. They will wrap them up after however long the procedure takes, get them to pee, or at least when I had my back surgery, that was the second one. Once I was able to go and use the bathroom, then that was when they felt I was safe to be discharged. They will be sent home. the same day as an outpatient procedure. This means that they won't get the 3-day required stay to trigger Medicare covering a rehabilitation facility, because this is how the law has been. You have the procedure, you stay in a hospital for 3 days where you're, let's call it the A team of surgeons, nurses, 24-hour care in a recovery ward. They're watching you and making sure there's no blood clots, no infections. And like, yep, we're going to now send you to a rehabilitation facility, which we're going to call the B team, only because they don't have surgeons. This has nothing to do with the care that's there. It's just if an infection develops and they need to put you back into a surgery suite, it's going to be a trip from the facility back to a hospital with a surgery suite. So that's not going to happen. So grandpa, even though he's older and maybe not at his peak fighting weight that he was in college and playing football without helmets, he's going to be sent home. And grandma, probably weighing between 80 and 112 pounds, is going to have to be the one that lifts him up out of the chair. That's going to need to know how to use any of the in-home care options, because there won't be anyone unless you pay for it yourself. Now, is it possible that inside the One Big Beautiful Bill, they magically also changed the provisions relating to qualification for rehabilitation facilities? Yeah, it's possible. But I'll tell you that the information was given to me through a source that would have told me if that was the case, because they are a rehabilitation facility. So all of that is to say, in this long rambling message, there is so much more that is coming down the pike that no one even knows about, because truly no one has gone through the full 1,200 pages of the One Big Beautiful Bill, except for those that are specifically relating to their own area of the world. So CPAs, they're all about the tax cuts and how are we going to change your tax filings. Medicaid recipients and Medicaid providers, they're going through looking at the Medicaid provisions. But it's very hard to find someone who has gone through the entire bill, looked at all of the provisions, and is talking about the interplay between one another. So again, if you're a senior on Medicare, please brace yourself that even though the news in July was focusing on those qualifying for Medicaid in the low income and asset qualifying programs, the One Big Beautiful Bill has taken a hatchet to your benefits as well. So happy Thanksgiving. I wish I had better news. Like I said, these are the things that are keeping me up at night, because I really do fear for the in-home accidents that are going to be happening when seniors are discharged immediately after having surgery. Because I'm going to add one more point, because it's not as if we have enough medical providers in the community anyway. There are some fantastic companies that provide in-home care. Have you tried reaching out to them lately to find out how easy it is to schedule, how much it costs, what their minimum requirement is to make it a feasible business model? Having now millions of seniors have to recover immediately in their own home, the system is going to break. And all I can say is that I hope that our mainstream media reports on the number of increased falls after surgery and deaths, because I fully believe that people will die because they're sent home right after surgery without the support and care they need to fully recover and rehabilitate after such procedure. So stay tuned. I plan to be talking more and more about the One Big Beautiful Bill and things that people may not know. The next video is going to specifically be relating to those on Medicaid and the $1 million cap on home equity and what this means for those specifically in Seattle, King County that may have a house they've lived in for 50 plus years, but be cash poor but house rich, and how you're now going to be faced with some extremely difficult choices. Thanks for watching. Again, if any of you need help or assistance with estate planning or estate administration, the law offices of Brent Williams-Ruth is always happy to provide an initial free consultation. Simply call 253-285-7751 and speak with my office director about setting up a time where we can connect. Thanks for watching.